Breast cancer in men is a relatively uncommon occurrence, accounting for less than 1% of all breast cancer cases. However, it is crucial to raise awareness about male breast cancer so that early detection and treatment can occur. Men, like women, have breast tissue, although it is typically less developed. The breast tissue in men consists of ducts that are responsible for carrying milk from the glands to the nipple. Breast cancer in men usually starts in the ducts and can present itself as a painless lump or thickening in the breast tissue. Other possible symptoms include changes in the skin texture of the breast, nipple discharge, which may be bloody, or the inversion of the nipple. In some cases, breast cancer in men may be detected through routine screenings or imaging tests. There are several risk factors that may increase a man's likelihood of developing breast cancer. These include 1. Age. Advanced age is a common risk factor for breast cancer in both men and women. The risk increases as men get older. 2. Family history. A family history of breast cancer, particularly in close relatives like a mother, sister, or daughter, can elevate the risk for both men and women. Men with a family history of breast cancer should be particularly vigilant about their breast health. 3. Genetic mutations. Certain genetic mutations, such as BRCA1 and BRCA2, increase the risk of breast cancer in both men and women. Men who carry these gene mutations are at a higher risk of developing breast cancer. 4. Radiation exposure. Previous exposure to radiation therapy, especially in the chest area, can increase the risk of breast cancer in both men and women. This is more relevant for individuals who have undergone radiation treatment for other conditions, such as lymphoma. 5. Hormonal imbalances. Conditions that lead to increased estrogen levels, such as Klinefelter syndrome, a genetic disorder in which males have an extra X chromosome, obesity, or liver disease, can be associated with male breast cancer. These conditions may disrupt the hormonal balance in the body and increase the risk. If a man discovers any changes in his breast tissue or experiences symptoms that are concerning, it is crucial to consult a healthcare professional. The doctor will evaluate the symptoms and may conduct various tests, such as a mammogram, ultrasound, or biopsy, to assess the breast tissue and determine the presence of cancer. The treatment options for male breast cancer are similar to those for women and depend on the stage and characteristics of the cancer. Common approaches may include surgery. The surgical removal of the cancerous tissue is a common treatment option. This may involve a mastectomy, removal of the entire breast, or a lumpectomy, removal of the tumor and a small portion of surrounding tissue. Radiation therapy. Radiation therapy may be used after surgery to kill any remaining cancer cells and reduce the risk of recurrence. It may also be used as a primary treatment in certain cases. Chemotherapy. Chemotherapy involves the use of drugs to kill cancer cells. It may be administered before surgery, neoadjuvant chemotherapy, to shrink the tumor, after surgery, adjuvant chemotherapy, to eliminate any remaining cancer cells, or as a palliative treatment for advanced or metastatic breast cancer. Hormone therapy. Certain types of breast cancer are hormone receptor-positive, meaning they depend on hormones like estrogen or progesterone to grow. Hormone therapy uses medications that block or suppress the effects of these hormones, helping to prevent the growth and spread of cancer cells. Targeted therapy. Some breast cancers have specific characteristics that can be targeted by medications. These targeted therapies aim to block the growth and spread of cancer cells by interfering with specific molecules or pathways involved in cancer development. It's important to note that prevention is also crucial. Men can reduce their risk of breast cancer by maintaining a healthy lifestyle, which includes regular exercise, maintaining a healthy weight, limiting alcohol consumption, and avoiding exposure to environmental toxins.